it really is a topic that doesn't get a lot of talk or some conversation, but it really does affect a lot of people. What are some of the most common forms of bladder conditions like infection or cancer, or what's the most common form of health issue for that right now?
Well, certainly, two of those you mentioned are certainly very prevalent. Infections are a big problem. Bladder infections, UTIs, that sort of thing. It affects lots of people from young to old, and they put a big burden on the patient, the healthcare system, and that sort of thing. And those are there's certain reasons we can do to help correct those or prevent them and lessen the frequency of them. But also, there's a lot of factors that go into it with aging and things that we can't control. But certainly the next most common scenario that would be affecting lots and lots of people, as the numbers would kind of show, is just overactive bladder, or bladder, a little bit of urinary incontinence even. And so I was looking back through some of these numbers as well, and you'll find lots of different ones in some ways, but some of them show here like overactive bladder, so having to use the bathroom more frequently, or when you got to go right away, or even to the point of having leakage or incontinence. 33 million people just in the US. And so it over about 40% of women between age 20 and 45 has some version of overactive bladder. As that worsens, it can, again, lead more into the incontinence and leakage, which gets, very, bothersome and embarrassing, and starts to affect their social, kind of, life and everything as well. And so, but many, many million people. And what's crazy about it is that most patients in general, men or women, either one, the average is 4 to 6 years they will, live with it or put up with it, before they talk to anyone about it, or seek out any kind of treatment. And that's what we're trying to, in some ways, promote with this Bladder Health Awareness Month, is that you don't have to just live with it. There's things we can do to try to help and things.
What causes overactive bladder?
So age is a risk factor. And so a lot of patients will say, well, I thought this was just part of getting older. And I'll say, well, it is more common with age, but yet again, you don't just have to live with it. Other medical conditions, diabetes, heart problems can cause kind of urinary changes. Old things that have happened in the past, that lead to changes down the road, different habits, kind of with different things in life that someone did that may affect their bladder down the road. Treatments for other diseases, such as radiation treatments for other types of cancers and things, can affect the bladder in that area. So unfortunately, it's an innocent bystander a lot of times, but yet it becomes a problem, and it certainly affects people and bothers them. So
As with anything else, treatment for this has grown leaps and bounds, and so why wait 4 or 5 years to get this looked at?
well, I think embarrassment is one thing. They don't like to talk about it. With their primary care provider. Unfortunately, there's the gender thing. If they have a male, maybe physician or someone, the women don't always want to talk about it, and that sort of thing. A little bit of embarrassment. They may have preconceived notions of what treatment is or kind of isn't. Well, my friend tried one thing and it didn't work, so I just assume that it won't work for me, or something to that effect. And then effectively they say, a lot of times they'll tell me, they'll say, well, I just kept hoping it would get better, or I would hope it would just go away, and then they eventually get fed up with it. So
What are the treatments for this? How easy is this treatable?
well, the treatments range in a very broad range of things, because not everyone's issue is the same, and even the cause of it, and their general problem as a whole. And so it ranges, and we walk people through this. As urologists, that's kind of one of the, certainly a big part of what we do. But even your primary care providers can be involved with a lot of this. But we look at risk factors and habits, or things, dietary things, factors, trying to avoid caffeine, and watching your fluids, and different factors like that, different foods to stay away from or whatnot. And then it can lead into, a lot of oral medication. So we try a lot of these, take, this daily pill. Now, as the phrase goes, it's a treatment, not a cure. So it's something that continues on, but and those can be effective for a lot, and they're happy to stay on that. And then we have other, things that can move on from there for people that don't, get the benefit from that. And that's where they find themselves with us when they've tried that sometimes with their primary care, provider as well. So
Is the success rate using those methods? How has the success rate increased? How has it gotten better?
it's definitely gotten better. I mean, there's about a dozen medicines out there for this. And so because again, common problem, lots of different, things for it. They all, they have similarities between them, but as far as the pills go and all, one work better for one person than the other and things like that. Different side effect profiles. Beyond medicines, we have what we kind of refer to as our advanced therapies that gets beyond the primary care realm and goes to the urologist, where we have what's called sacral neuromodulation, where we have a way of helping kind of regulate the nerve impulses to and from the bladder to cut down on this overactivity and the leakage. We even have Botox injections into the bladder. There's other types of nerve stimulation, and then it ranges all the way into like major surgery for the really crazy cases where we even remove bladders at times. So when I put all this into perspective for people, say you're right here in the middle, right? You're not anywhere near this extreme or something, so that helps them think that they're not crazy for thinking this is out of control or something. So
Has bladder cancer, and again, it's one of those that just doesn't get a lot of talk about. How prevalent is that nowadays?
well, it's unfortunately one of the big drivers of it is cigarette smoking, and so bladder cancer is driven by that, and although that has gotten less, over some years, there's still a lot of it and a lot in this area, and so I think it's one in 20 men may have some version of that in their life. It's really high numbers. It's pretty crazy. Luckily, it's not, as bad as some types of disease and other people may have. But overall, the rates are fairly stable because there are still, people out there that, do smoke standard kind of cigarettes and things. That's the biggest risk factor, and so we still see it all the time. And luckily, the treatment on that is based a lot on how quickly you get to it, like a lot of things. So one of the first things that may be noticed is blood in the urine, either visible, much less, or even just on a test, like at the doctor's office. If there's any blood in the urine, that needs to be evaluated. So.
So the bottom line here is you got something going on you're not sure about. Don't wait.
Well, right. I mean, the ounce of prevention versus the pound of cure, perhaps, along that spectrum of things, catching any, especially malignancy, usually early on is a major difference than catching, than when you diagnose it at a much more advanced stage. Yeah, the options for treatment are much easier and better, and obviously the outcomes are better too. So,
Yeah. All right, Dr. Basham, thank you so much for your time.
all right. Thank you, Darren. Have a great day.